This is the beginning of the process, and we look forward to working with them and others to make certain that, again, we come up with that process that aligns with the principles that we've defined, that they actually adhere to or agree with as well. And that is that we need a system that's affordable for folks, a system that's accessible for individuals, that's of the highest quality, that incentivizes innovation, and that empowers patients. And so we look forward to working with them through this process. Yes, ma'am.
Secretary, Congressman Chaffetz said today that Americans may have to forego a new iPhone to pay for health care, and they'll have to kind of make these choices. Does the administration agree with that? Will Americans under this plan, will they need to maybe sacrifice other goods to pay for their health care?
This is an important question because what's happening right now is that the American people are having to sacrifice in order to purchase coverage. And as I mentioned, many individuals can't afford the kind of coverage that they have right now. So they've got that insurance card, but they don't have care. What our desire is to drive down the health care costs for everybody. And the way that you do that is to increase choices for folks, increase competition, return the regulation of health care where it ought to be, which is at the state level, not at the federal level. All of these things that taken in their aggregate will, in fact, decrease the cost of health care and health coverage, and that will allow folks to be able to purchase the coverage that they want. Yes, sir.
Thank you, Dr. Price. I have two questions for you. First has to do with guarantees that you can make as the administration's point person on this legislation. Can you guarantee that whatever legislation emerges and makes it to the president's desk will allow individuals, if they like their doctor, they can keep their doctor? And the second guarantee is, can you also guarantee that health care premiums for individuals will come down with this new legislation?
Again, a remarkably important question because, as you'll recall, the promise from the last administration was if you like your doctor, you can keep your doctor. If you like your plan, you can keep your plan. Both of those promises turned out to be not true. We think it's incredibly important for the American people to be able to select the physician and the place where they're treated themselves, that the government ought not be involved in that process. And so our goal is to absolutely to make certain that individuals have the opportunity to select their physician. In terms of premiums, we believe strongly that through this whole process and as it takes effect, that we'll see a decrease in not only the premiums that individuals will see, but a decrease in the cost of health care for folks. Remember that was another promise that the previous administration made, that you'd see a decrease in $2,500 on average for families across this land. In fact, what they've seen is an increase of $2,500 or $3,000. So we're going to go in the other direction. We're going to go in a direction that empowers patients and holds down costs.
Yes. Mr. Secretary, you are quite a distance away from conservatives with this plan, and the central part of it, which is tax credits, which they see as yet another entitlement, very similar to the entitlement of Obamacare, they're different in form. How do you convince them, since it's going to take tax credits to make this work, that they need to swallow this and move forward with the bill? I mean, you're getting an awful lot of opposition on this central tenet of this whole thing.
Remember, this is all about patients. And in order to provide that transition and in order to make it so that nobody falls through the cracks, we've got to have a system that allows for individuals to gain the kind of coverage that they want. And we, conservatives and others, have said for a long, long time that we believe it's important to equalize the tax treatment for those purchasing coverage, gaining coverage through their employer, and those not. And the tax credit is the opportunity to be able to equalize that tax treatment. Folks have talked about this for many years, actually, so that there's not a distortion in the tax code for who's able to gain a benefit for being able to purchase coverage and not.
Hey there, thanks for checking out CNBC on YouTube. Be sure to subscribe to stay up to date on all of the day's biggest stories. You can also click on any of the videos around me to watch the latest from CNBC. Thanks for watching.